Dr. Donald Pelto.
Not yet, not yet.
Alright, this is Dr. Donald Pelto, and we're going to be doing a nail procedure on one of my patients here. So the first aspect is to make sure that there's no pain. Feel okay? He's anonymous in this. So I've marked the side of the nail. This has been chronically getting ingrown. And the first thing I'm going to put a little toe tourniquet around it. The next step is to free up the nail around the edge. You can turn on the music maybe. What's everyone wants to learn? So I free up the edge of the nail on both sides. That hurt? That's okay. Good. And I take this as an instrument called the English anvil, and I cut all the way back, and I push back the skin and take out a portion of nail. And I take a nail splitter and I split it all the way back. Next, what I do is I take a hemostat and grasp all the way down to the base, clamp it, remove your fingers, that's the key, and you twist until that piece comes out. And that's the piece that was ingrown. And you take a curette and you see if there's anything left in the edge. And see all this buildup on the edge? This is where the nail gets actually grown in there, and it gets painful and it builds all this extra buildup. And that's what I'll trim away with this. So you can actually see away on the inside. If you look, it's very irritated from the nail constantly pushing into the edge on both sides. Once both ends are cleared out, then I'm going to get my phenol. Put it on my Q-tips. Okay. And then we do them one at a time. Turn the timer there. Go ahead. On that edge and on that edge. And we just let it sit for 30 seconds. And that's going to cause the nail base there to be burned. Phenol is actually a very strong base, and it's going to cause a burn. So afterwards, this is going to drain quite a bit in the nail edges. That's why I recommend the most important thing after this type of procedure is to really scrub your foot really well with soap and water with the face cloth and clean it out. And then afterwards, you'll be putting some medicine on there called a Marigel, and that's going to be used to help neutralize any acid that may be left over for the next few days, and it's also going to help speed up healing. It's used for a lot of other people that have wounds. It can help things heal up. But you really want to make sure you get in the edge. Because occasionally what can happen after a procedure like this is it can have a little, kind of a spicule or a little piece of nail that comes out, and it has to be retreated. And we don't want that to happen. And this type of a procedure is done for someone that has ingrown toenails chronically, more than once. If it happens once, twice, or you're having to always have to trim out your nails. Next we dilute it with some alcohol. And this is diluting the phenol in there. And all that white area in there is actually the where it got burnt on the inside of the nail. Now what I do is I put a little of this Marigel right on the nail edge. A couple of pieces of gauze, some tape. The hardest part is putting tape on when you have gloves on, and then I'll take one little piece of gauze. If you have an extra one, just a non-sterile gauze. And that one goes on there. And then the first time we put a little bit bigger of a dressing on here, and I'll show you how to do that. The following days you don't need to do something as elaborate. But I just put a little toe sock on it. Go around one more time. And that's how you do it.